And we are joined once again this morning by Dr. Jeff Harp from Highland Family Medicine. Doctor, good morning.
Good morning.
Well, the topic of the week, the topic of the day, of course, is the reopening. We are one of 3 regions across the state that will begin that process coming up at the end of the week. Let's talk a little bit about how we got here and what exactly it means when we say it's time to reopen.
Well, the governor and his team have created a comprehensive set of guidelines that should be in place in order to open a region. These guidelines really follow advice set forth by the Center for Disease Control here, the World Health Organization, and the White House Coronavirus Task Force. And they basically say what conditions and capabilities need to be present in an area in order to allow it to open safely.
I think that's really important. These are medically based guidelines. What specifically do they call for?
Well, basically, they want the rate of new infections in an area, in a region, to be low. They want the healthcare system to be able to accommodate a second wave if it occurs. And they want to be able to test and track new cases as they develop in order to try to slow the spread of the disease.
So much at stake with reopening. How will our success rate be monitored going forward?
So each region will have what's called a control room, a group of about a dozen leaders from government and business who will be getting information from hospitals, from the health departments about what's happening with the infection, and they'll be reporting to the state. Based on what they send the state will say, okay, keep going ahead, or perhaps slow down, or perhaps even let's go backwards a little bit because maybe things aren't being as well controlled as we want them to be. So that control room will govern how the region opens.
All right, we certainly don't want to go backwards. Let's get into your wheelhouse. How will hospitals be involved?
Hospitals will be sending their statistics to the control rooms and to the states. They'll be keeping beds open to take care of new cases. And the hospitals have really been a major force in getting enough testing into the region. In our region, basically, the hospital systems need to be able to do about 1,200 tests, 1,200 tests a day in order to keep the region open.
All right, what about the rest of us? What can we do? What should we be doing to help the reopening be successful?
Well, the guidelines are quite clear that as we reopen, we have to continue social distancing. So businesses have to figure out a way to maintain social distance while reopening. You'll notice that retail businesses, for example, at first have to do only curbside business, not in the store business, and slowly they'll be able to start doing that. So what can we do? Individually, we can monitor ourselves for symptoms. If we have symptoms, get medical attention, get tested if it's recommended. We can cooperate with the health department. If the health department calls us and says you're positive, this is what you need to do. You need to isolate. We can report contacts. The health department will be contacting people that have had contact with us if we become positive. And then if we get one of those calls, we can put ourselves in quarantine like they'll ask us to do and monitor ourselves for symptoms. And most importantly, we need to keep up the healthy habits that we've developed of wearing a mask when we're in public, staying 6 feet away from people, using sanitizer on surfaces, washing our hands regularly, and of course, just staying home when we're sick. So stopping to spread the disease.
We all have a role to play. Doctor, as always, thank you for your insight.
You're welcome.